she's joined this morning by another doctor, Dr. Amy Derrick. Let's go over to both the doctors.
Good morning. We had many questions have come in with email about cosmetic fillers, so I invited an expert to talk about them. This morning my guest is Dr. Amy Derrick, who's a board-certified dermatologist with an office in Barrington, and she's going to walk us through some of the questions. Good morning, Dr. Derrick.
Good morning, Dr. Malloy. It's great to be here.
And thanks so much for coming. So I think we'll get right to it. What exactly are fillers?
Fillers, the term fillers is just a generic term for a substance that's injected into the skin in order to create volume. As we age, not only does our skin wrinkle and get dark spots, but we also lose volume. And fillers are a way of restoring volume.
So this is a way of injecting volume in it. I think you brought exactly how they work.
This is an example of a filler called Radiesse. It lasts about 1.5 years, and I brought this to show you what it looks like. It's not a hard implant. It's a soft gel that's implanted into the skin to create volume.
And that would last about 1.5 years.
This specific filler does last about 1.5 years.
And these are all different products, and the dermatologist would be the one that would advise you as to which one would be right for you?
Exactly. It is imperative that if you choose to do a filler treatment, that you go to a board-certified dermatologist or plastic surgeon.
And what about how would you choose which one, or they would choose for you?
I think in consultation with your physician, you can make a decision. There are many different types of fillers. Some are temporary and some are permanent.
And what is the difference? I think this is many people have asked, what's the difference between a filler and Botox?
Botox is an injectable substance that causes relaxation of muscles, so it softens worry lines, frown lines, and crow's feet. Fillers, on the other hand, are used to restore volume in the face.
So that sort of plumps up things.
Exactly. One relaxes and the other plumps.
Now, what areas of the face could they be used in? What areas can be plumped up?
Exactly. Most commonly, the nasolabial folds are plumped, but also a downturned mouth called the marionette lines are plumped, as well as the tear troughs, which are hollows in the eyes, temples, and cheek augmentation.
So quite a few places can be used. And now you brought some before and after of some of your patients, and can you just walk us through there? What was done?
These are patients who have had a treatment called Sculptra, and I brought these from the company to show you in a standardized fashion what it looks like when you have infusion of volume into the face. This is a before photo of a lady, and this is her after photo. You can see that the volumization of the skin takes about 20 years off of this woman.
She has injected beside her mouth.
Actually, she's had Sculptra injected in her cheeks, which causes a lift and more youthful fullness to the face.
And about how long would it take her to recover? Could she walk right out, or?
Some people tend to bruise more, but for the most part, it's a very short recovery time, depending on what you're taking.
Okay, and here's the next patient.
This young gentleman looks drawn and angular with his face. It's hollow, and you can see here the depressions. He looks older than probably his stated age. And in the after photo here, he has a youthful roundness. And this is also post-injection with this filler called Sculptra.
Are you seeing more men coming in now?
Absolutely. Men frequently use things like Botox, for example, to decrease the frown lines and that vertical furrow in the face, as well as using some fillers in order to make their faces look more youthful.
And how much would an injection cost, an average?
The temporary fillers, such as Juvederm, Restylane, and the newly FDA-approved Perlane, cost between usually $500 and $1,000 per syringe. The extended duration fillers, such as Radiesse and Sculptra, are about $1,000 a syringe. And the permanent fillers, such as Artifil, which is also newly FDA-approved, can be in the thousands of dollars per syringe.
So it's an expensive way, but it's a way to the fountain of youth. Thank you very much for coming in, and I think you've updated us, and we really have to think about that. I think it sounds like a good deal. What do you think, Kim and Rob?
I guess she's saying that I need it. I know.
Not at all.
I've been talking about this all morning. You don't need anything. You're
I was like, does she have an extra shot for that? If you have a medical question you'd like Dr. Malloy to answer, here on NBC5, you can reach her by going to NBC5.com/help.